Welcome to the Crystalline Silica Substance webinar hosted by SafeWork New South Wales. My name is Johnny Auditore, State Inspector for the Construction Services Group, and I'm your host for this webinar. Today I'm joined by a panel of inspectors who I'll introduce to you shortly. Before we begin, I'd like to acknowledge that I'm hosting this webinar from the lands of the Barramatical clan of the Darug people. I also acknowledge the traditional custodians of the various lands on which you all work today and the First Nations people participating in this webinar. So let's begin with the housekeeping. This webinar will run for approximately 1 hour, which will consist of a presentation and then followed by our live Q&A session with our inspector panel. You will see our Q&A option on your screen, so please feel free to add your questions that you wish to put to the panel. We will endeavour to answer as many questions as possible in today's session. As part of your registration, you will be provided with a post-webinar email that will contain links to the recorded webinar session, as well as other useful resource links in relation to crystalline silica substance, also known as CSS. What we'll be covering in today's webinar is the new changes to the legislation in relation to the management of CSS and what you need to know to ensure compliance and to keep workers safe. For participants who wish to see live captioning for this webinar, please go to the More icon located on top of your screen, then select the language and speech option, and then turn on the live captioning. I would like to take this opportunity to highlight that dust can be a problem in any industry. Whilst the hazards of CSS are well recognised, there are many more substances that, when present in dust, are hazardous to health. Exposure to all dust needs to be eliminated, and if it's not reasonably practical to eliminate exposure, it must be minimised. From 1 September, persons conducting a business or undertaking, also known as a PCBU, a legal term referring to employers, will have specific duties in relation to the management of risk associated with the generation of harmful silica dust from the processing of CSS. All crystalline silica processing must be controlled, and if it's deemed as high-risk crystalline silica process, the PCBU must meet additional requirements to ensure the safety of workers. In this webinar, we will give a high-level overview of the new changes. There has been a strong focus on engineered stone manufacturing industry over the past few years. The new regulation will ensure the risks associated with CSS are being managed. This includes a requirement for all processing of CSS to be controlled by using appropriate methods such as using water, dust extraction, or ventilation. Anyone who works with silica-containing products in a way that is deemed to be high-risk process will also need to be trained. To get a better understanding of the new regulation, there are two main elements you need to consider when you're working with CSS that will determine whether the new legislation impacts you. Firstly, you'll need to determine if you are working with CSS, and if you are, secondly, does working with this substance is considered as a process work. Please note, when we're discussing about process work, we are talking about activities that produces dust from CSS that presents a risk to workers' health. These are the triggers that will require the PCBU to take additional action in managing the risks associated with CSS. We will provide more detail in this presentation on these two elements. As you can see in the flowchart, changes to the WHS regulation commencing from 1 September will require PCBUs who are involved in the processing of CSS to assess if the activity is high risk. It is a requirement for this assessment to be recorded in written form. If the processing is not considered as high risk, then work can continue, but you will be required to manage the risk associated with the task. In the event when processing is considered as high risk, there will be additional requirements for PCBUs. This includes the development of a risk control plan, reporting of workplace exposure standards exceedances from air monitoring samples, and specific training requirements. Please note, in the event when you are unable to determine if the processing of CSS is high risk, the new changes to the regulation require you to deem the processing as high risk activity. This will mean additional requirements, as mentioned, will need to be applied. So what determines whether processing the CSS is high risk? This is a question you need to ask yourself if it is reasonably likely the processing of CSS will result in risk to the health of the person at workplace. So how do we determine if processing of CSS presents a risk to a person's health in the workplace? You'll need to consider all the following factors. Firstly, before you can determine whether the processing of CSS is high risk, you will need to determine if you will need to identify if the material you are working with contains at least 1% crystalline silica. Silica can be found in many products, both natural and man-made. As you can see on this table, here are some examples of material containing crystalline silica. If you're unsure about the crystalline silica content of a specific product or material, you can refer to the safety data sheet for further information. Once we have established that the material you are working with contains at least 1% crystalline silica, you will need to determine if working with the material constitutes as processing. The processing of CSS involves activities that produce respirable crystalline silica, also known as RCS. Crystalline silica substance on its own is not hazardous until you conduct processing that enables it to transform into RCS, which is hazardous to one's health. Activities that are considered as processing in relation to producing RCS, which is defined in the regulation, are 1. The use of powered tools or mechanical plant to carry out an activity involving the crushing, cutting, grinding, trimming, sanding, abrasive polishing, or drilling of CSS. 2 is the use of road headers to excavate materials that contain CSS. 3 is the quarrying of or the tunneling through or the mechanical screening of material that contain CSS. And last of all, an activity that would impact many different industries is a process that exposes or is reasonably likely to expose a person to RCS during the manufacture or handling of CSS. So once we've established that we are working with material that contains at least 1% crystalline silica and conducting processing of that material, we will then need to determine if workers are exposed to RCS in the workplace and is reasonably likely to exceed half the workplace exposure standard. The workplace exposure standard for RCS is 0.05 milligrams per cubic meter over a time-weighted average of 8 hours. In the event where the activity produces airborne concentration of RCS in the workplace that is reasonably likely to exceed half the workplace exposure standard, this activity will be considered as high-risk silica process work. So how can we determine if the activity will exceed half of the workplace exposure standard? Here are some examples that will provide you some guidance on this issue. Examples of activities that are likely to exceed half of the workplace exposure standard include grinding of concrete, cutting of concrete or bricks, or jackhammering concrete or sandstone. Examples of activities that are unlikely to exceed half the workplace exposure standard include the use of manual, that is non-powered tools to score, snap or split tiles or bricks, the mixing of dry materials for less than 15 minutes per day, that is mixing small amounts of mortar or concrete, and hand sanding and finishing. And last of all, reviewing the workplace history can assist you in determining if the processing is high risk. When reviewing your workplace history, you must consider previous health monitoring results as well as any other history involving previous incidents, illness, or diseases associated with exposure to RCS at the workplace. If you have identified any of these events being linked to a process, then it will be determined as high risk. One important point you need to consider when determining if the processing of CSS is high risk is the assessment must not factor the controls that have been implemented in the workplace that reduce the risk of exposure to RCS. This means if the process itself produces an exceedance of half of the workplace exposure standard and you have controls in place to reduce the exposure of RCS to workers, the processing is still considered as high risk, even though you have controls in place to manage the risk. The assessment of processing of CSS must be based on no controls being implemented. As mentioned, we have looked at the definition of processing of CSS and what determines the processing as high risk. Once we have identified the processing is high risk, additional requirements involving the development of Silica risk control plan, the reporting of workplace exposure standard exceedances, and specific training will need to be implemented on top of your existing requirements to conduct air and health monitoring. We will now look at these individual new requirements in greater detail. As we have identified the processing of CSS as high risk, the PCBU is required to develop a Silica risk control plan. This plan is designed to document the specific tasks and related control measures to be implemented by the PCBU. As a minimum, the Silica risk control plan must contain the following. 1. You must have information about the PCBU and high-risk CSS process work that is being carried out at the workplace. Secondly, you need a copy of the information used to assess the risks of that process. 3, you need to document what control measures will be used to control the risk and how those measures will be implemented, monitored, and reviewed. And last, which is optional, evidence of training. Please note that the plan must be set out and expressed in a way that is easily understandable for workers. If the processing of CSS is related to construction work activity, then that activity can be considered as high-risk construction work. In this case, SafeWork method statement can be used in place of the Silica risk control plan if it meets minimum requirements of the plan. The requirement to conduct air monitoring remains the same. The main trigger that initiates a requirement to commence air monitoring in the workplace are 1. If the PCBU is unsure if the workplace exposure limit for RCS is being exceeded, or 2. If the PCBU is unsure about the implemented controls at the workplace are effective in managing the risk of exposure. In addition to this requirement, the new changes to the regulation requires on completion of air monitoring, any results that identify airborne concentration exceeding a workplace exposure standard, the PCBU must report the findings to SafeWork as soon as reasonably practical and no more than 14 days from the date the result was reported. Please note the notification form will be available on our website from 1 September. And the last of the changes to the regulation will require mandatory training for workers undertaking any processing of CSS that has been assessed as high risk. The training course must be an approved course specified by SafeWork New South Wales. Further information on approved courses will be available on our website. It is important to note that all records of training of workers are to be kept by the PCBU for up to 5 years after the worker left the business. And also it is a requirement for PCBUs to pay for their workers to undertake this mandatory training. This includes the actual training course and the work time spent to complete the training. The requirement for health monitoring doesn't change. When there's a significant risk to the health of workers, for example, exposure to levels exceeding the workplace exposure standard, health monitoring is required at the workplace. Please note that this is required regardless if you're using the face mask to manage the risks. We often do get asked a question around who pays for health monitoring for labour hire workers. As this is a responsibility shared between both the host employer and the labour hire company, consultation between both parties is required so an agreement can be reached on who will organise and pay for the health monitoring service of workers. I would like to take this opportunity to look at how you can effectively control the processing of CSS within the workplace. The regulation requires the PCB to eliminate or minimise the risk arising from processing activity by at least implementing one of the following controls by 1. The isolation of a person from dust exposure. 2. Providing a fully enclosed operator cabin fitted with high-efficiency air filtration system. 3. Having an effective wet dust suppression method. 4. Providing an effective on-tool extraction system. And 5. Providing an effective local exhaust ventilation system. And in the event if a person is still at risk of being exposed to RCS with the mentioned controls implemented, then workers are to be provided with respiratory protective equipment and are required to wear it while carrying out the activity. As part of our ongoing support for small businesses, SafeWork New South Wales has a small business rebate program to help businesses to purchase essential safety items. It is crucial that your workplace is fitted with essential safety items, not only to avoid a possibility of a $4,500 fine, but also to protect and improve work health and safety for both you and your workers. The Small Business Rebate Program offers $1,000 of rebates on eligible safety items. To find out if you are eligible for the Small Business Rebate, or for more information, please visit the New South Wales Government website. For more information on legislative changes and how businesses and workers can comply with the new requirements, you can access our website for further details. Information that is currently available on our website are the SafeWork Australia guidance material, various fact sheets around the topic of Silica, and we also have instructional videos. Please refer to our website regularly as we'll continue to provide further updates and new material in reference to this topic. Should you like to contact us and speak to one of our team members directly, you can call us on 13 10 50.